I want to talk about Amlodipine, Lisinopril And Losartan. These are the popular drugs that are being prescribed for hypertension. And in this video, I'll be breaking their differences. I'll be sharing with you the differences, their classes, their similarities, and so forth. If you are yet to subscribe to this channel, I plead with you, put on subscribe, put on the notification button, because I'll be posting videos that will inform you, that will also be a source of information to you, whether you're a medical student or not, whether you are a patient. Please subscribe. If you're watching me on TikTok, on Facebook, on Instagram, please follow. If you're watching on X, still follow me, and you won't regret it. So let's go into the video. So under this topic, we'll talk about what's Amlodipine, Lisinopril, and Losartan. What class? Because when you talk about antihypertensives, we have many classes. When you talk about antihypertensive, we have many classes. Amlodipine is in a class called calcium channel blocker. I'm going to, just follow me, I'm going to explain as I move. This is just to specify their classes. As I continue this video, I'll be explaining them. Amlodipine is in a class called calcium channel blockers. Lisinopril is in a class called angiotensin converting enzymes inhibitors. Losartan is also in a class called angiotensin receptor blockers. Angiotensin receptor blockers. So these are the classes of these drugs. Amlodipine, they're not in the same class. So they work through different ways to achieve a goal of reduction in your blood pressure. I'm talking about the mechanism of action. What are the mechanisms of action of these drugs? They don't work the same way. Number one, as I mentioned, is amlodipine. Amlodipine is a calcium channel blocker. It blocks calcium from entering the smooth muscles in the body. And because when the calcium enters the smooth muscles, like the smooth muscles in your heart and in your muscles, it causes what we call constriction of the arteries and veins. It causes constriction. It causes constriction of these muscles. As it makes them to be tightened, and so put more pressure on the heart, and the heart will begin to pump more, which will in turn increase the pressure. So what this amlodipine does is that it blocks calcium from entering the smooth muscles, causing dilation in the blood vessels, and the heart will freely pump blood, and the blood will move to wherever it's being sent. So that is the work. That is how amlodipine works. In a layman understanding, amlodipine opens the blood vessels so that blood will flow easily. That is just the work of amlodipine. So the number 2 in the list is lisinopril. Like I told you in the beginning, lisinopril is an angiotensin enzyme inhibitor. So inhibitor means that it blocks angiotensin enzyme, because when angiotensin is an enzyme, when it's released into the body, it causes the absorption of water back into the body. So this lisinopril goes to block angiotensin enzyme, and when it blocks it, the aldosterone, which is an enzyme that works with signaling, sodium and chloride balance in the body. I know you may not understand if you're not a medical student, but when it blocks it, in turn, it stops the absorption of water. It stops the absorption of small salts into the body. What are the differences between these three drugs? Amlodipine, Lisinopril, and Losartan. Well, amlodipine works through the calcium channel. Lisinopril and Losartan works through the RAS system, RAAS, renin, angiotensin, aldosterone system. So they work through the system to reduce your BP, while amlodipine work by blocking the calcium channel to reduce your BP. And also, second difference is that when it comes to cough, amlodipine and Losartan does not exacerbate cough. It's rare. But lisinopril exacerbates cough because of the way it works to reduce your blood pressure. That's number 2. Number 3, lisinopril and Losartan increases the level of potassium. That is why if you are on this drug, the doctor might advise you not to take too much bananas, because bananas have potassium in it. The doctor might advise you not to take much bananas while taking this drug. Or if you're having kidney issues, the doctor might advise you not to take bananas at all, or minimize your intake because of increase in potassium. That's for lisinopril and Losartan. Yes, amlodipine can, but the tendency of amlodipine increasing your potassium level is little compared to lisinopril and Losartan. Third difference is kidney protection. When you want to say, okay, the kidney is having issues, how do we protect the kidney and also reduce the blood pressure? You can go for lisinopril and Losartan. Both of them have high tendency of protecting the kidney from damage while still working on reducing your blood pressure. So these are a few differences that you can find when you are taking this drug. Then under side effects, these drugs have side effects. For amlodipine can cause what we call peripheral edema. That's the swelling of your ankles, swelling of your ankles. That's peripheral edema. It can also cause dizziness. It can also cause headache. It can also cause gum enlargement in some patients, not all. So lisinopril can cause dry cough. It can cause angioedema of the face or the lips. That's swelling of the face and the lips. It also has the tendency of increasing the level of potassium in your blood. That's hyperkalemia. It also have effect of lowering. It can lower your BP beyond normal if you are not monitoring your blood pressure. It can cause hypertension. For losartan, it has tendency of also increasing the potassium intake in your blood, at the potassium level. It also has the tendency to cause back pain. Maybe some, but not on all patients. Though it also has the tendency to cause angioedema, that's swelling of the lips and the face, depending. Losartan also has the tendency to cause dizziness. Which patients are not permitted to take this drug? There are patients that are not permitted to take any of this drug. Number one are pregnancy. If you are pregnant, lisinopril, amlodipine is not for you. If you have kidney issues, serious chronic kidney issue, lisinopril and losartan are not for you. Or if you have high level of potassium in your body, lisinopril is not for you. For amlodipine, if you have low blood pressure, you are not permitted to take amlodipine. Now, clinical uses. In which clinical case can we say, okay, lisinopril is better, or amlodipine is better, or losartan is better? For amlodipine, it is good for elderly patients. It is good for elderly patients. So if your patient as a doctor or a pharmacist is an elderly woman or a man, you can recommend amlodipine to help bring down the blood pressure. And amlodipine works for a longer time. So it is good. It is once daily. It is good for those who don't like taking much drug. And also amlodipine can be given for isolated systolic hypertension. That is the upper, when you take your blood pressure, we have the systolic as the upper number level, and we have the diastolic as that is the lower level. So if the person is having isolated systolic, so it is only the systolic that is going up, amlodipine is good in handling such cases. For lisinopril, it can be recommended or prescribed for diabetes. It's good for diabetes. It's good for diabetes who have high blood pressure. It can also be prescribed to patients that have experienced heart attack before, or that have experienced heart failure before. So for losartan is given in place of lisinopril if the patient have a tendency of cough. So losartan is also given for kidney protection, so that it will also protect your kidney while working towards reducing your blood pressure. Can these drugs be used together? That's a question you may be asking. Yes, but in this format. Amlodipine can be used with lisinopril. Amlodipine can also be used with losartan. But lisinopril should not be used with losartan because they work from the same system. And using the same drug that work from the same system to lower your BP can result to a clash, which can exacerbate side effect. That is why I will not advise you as a pharmacist to combine lisinopril and losartan together.